Let's talk about how to prepare for a C-section. I'm preparing to have my second C-section. Based on what I learned from my first one, based on what I know as a physician, I would like to share with you a few tips on how to prepare for a C-section. So let's start from talking about planned and unplanned C-section. Planned C-section is very similar to any surgical procedure. You book your day, you show up to the hospital a couple of hours before the scheduled time, you have a procedure done, and you move to recovery. The positive things about planned procedure is you mentally and physically ready to have that procedure. You know what's going to happen and you have time to prepare for the procedure and for the recovery. Also, planned C-section tend to be less traumatic, less blood loss, and done in more controlled environment. Meaning, most of the time they're done during the daytime when all the resources available. Unplanned C-section usually happen in any time of the day when women initially plan to have a vaginal birth, but something went wrong and it required intervention as a C-section. Quite frequently, it's done as the emergency intervention, where there is zero preparation, where procedure done very fast, and the main goal of the procedure is to save the baby and a mom from any possible impending complications. In that case, it obviously can be very traumatic for a woman to plan to have a vaginal birth and then end up with a C-section. It also can be very traumatic for recovery because frequently you can be in labor for 2, 3, 5 days, exhausted, and then end up with a surgery that complicates your recovery even further. So you can't really prepare for unplanned C-section, but you can prepare for planned C-section, and that's what I would like to focus on. However, all the tips can be used during the recovery after emergency unplanned C-section as well. Here's the list of a few things that you should prepare to have for better recovery after C-section. Medications and certain items that will help you to recover, things that you will take with you to the hospital, arrangement that you should make at home, and some tips that will make life easier. So let's talk about some stuff that you should get in advance. Let's start with the pharmacy supplies. Ibuprofen, Motrin, or Advil is all the same. It decreases the inflammation and speeds up the healing process. It's the same group of pain medication, and I like taking them together because they work differently, so you can take them both at the same time. Also decreases the inflammation and speeds up the healing. Something that's very common after C-section is constipation. But starting Miralax, at least half of the dose daily immediately after C-section can help speed up return of the bowel movements. Majority of pain after C-section comes from that entrapped gas inside of your stomach. Gas actually helps to decrease that pain. It's not only for the gas in the bowels, it can also help with intra-abdominal gas. The next item is surprising, but actually few studies have shown that chewing the gum immediately after abdominal surgery tricks your body into jump-starting GI motility. Now let's talk about some items that you should get. Compression stockings. The day 2 after C-section, you will be very swollen. Compression stockings helps to relieve the discomfort, decrease the swelling, and speed up the recovery. Another helpful item is the underwear, to make sure that underwear goes above your C-section scar. Some people prefer the mid-rise underwear, where they just going over the C-section up to belly button. But there are also underwear that goes up to your rib cage. This type of underwear is less likely to roll down and irritate your scar. It also provides some support for your abdominal muscles. And speaking of support for your abdominal muscles, make sure to get abdominal binder. Request one while you're staying in the hospital. It's a pretty simple binder, and you might find it very useful to use initially, immediately after your C-section. But there are other ones that you can purchase online that are a little bit more advanced and can be a little bit more comfortable and provide more support. And also, if it gets dirty, it's better to have multiple binders so you can wash it and swap it. Another item is silicone strips. Couple of weeks after C-section, you can start applying the silicone strips over your C-section incision because silicone has shown that it decreases the scarring and prevents keloid formation. There are also some home modifications that I highly recommend you make. Getting a step stool for your bed will help tremendously, especially if you have a higher bed. Another helpful item is the bed rail. Remember that after abdominal surgery, you won't be able to use your core muscles, but the bed rail will help you to use your upper body muscles to lift yourself in and out of the bed. In the bathroom, consider getting a squatty potty. Squatty potty is a step stool that usually placed next to the toilet. So when you sit on a toilet, you can put your feet, and it helps to align your pelvic floor muscles to help evacuate your bowels more efficiently. If you have a multi-level house, it's better to stay in one level at least the first couple of days because it might be a little bit difficult going up and down the stairs. So make sure you have your place set up with all necessary items in one spot. If you can't avoid staying only on one level, make sure that you have a double of everything on both levels where you're going to spend most of the time. Another preparation that might be helpful in your recovery is plan your meals. In terms of meal prepping, pre-portion food that can be frozen and easily reheated is a great option. Make sure to prepare it ahead of time. Some people organize what's called a meal train when your friends and family bring you food daily and take turns. The last thing you're gonna wanna do is to stay over stove and cook dinner. If you have other kids and animals, make sure you make arrangement on who's going to be taking care of them while you're having your surgery and recovering in the hospital and after the hospital when you get home and still recovering. C-section is the major abdominal surgery where the cut goes through many layers and it requires a recovery. So it's normal to expect to be in the hospital for about 3 days. Usual recovery takes about 6 to 8 weeks. Some people feel better sooner, some people take the longer time to recover. But the main thing, you need to make sure that you avoid excessively heavy lifting and not engaging your core as much during that recovery. So if you're planning to have a babysitter, a housekeeper, a dog walker, it's better to arrange those things in advance. What to pack when you go to the hospital to have your C-section. Make sure to take a big suitcase. Compression stockings, underwear that goes over your C-section scar and also supports your abdominal muscles. Abdominal binder. Hospital will give you the regular one, but I prefer my own one that's a little bit more comfortable. Sweatpants or pajama pants, whatever you feel more comfortable with. Also make sure that it goes over your C-section scar. And bring a gum. Make sure to leave a lot of empty space. In majority of hospitals, you will be provided with sanitary pads, hospital underwear, diapers, and formula for the baby. It's expected that you're going to use it during your stay, but it's also okay to take it home with you. Diapers and formula are expensive. Make sure you take advantage of it. C-section is the major abdominal surgery, but if you plan right for your recovery, it will leave you more time to take care and enjoy your newborn.